healthy body, healthy mind, mind should be healthy. Positive thinking.
Right, so that is a mental health state. But I am asking you, what is mental illness as per you?
Mental illness when you go negative, think all the time negative,
Okay.
mind.
Okay. So sir says over here that anybody who thinks very negative and all the while thinks about weak stuff or is not very positive in his thoughts, weak mind, is something he feels can be a mental illness. Yes, Bharat?
Mental illness will be symptoms in the person which is not normally found in a normal person.
Okay, can you give me some symptoms which you feel?
Excess of anxiety,
Excess of anxiety,
depression,
depression, madness. Please remember this term, madness. Yes. Yeah, no, we will talk about this term. Yeah, that's so. No, you're not wrong. I'm just coming up with, because this is a video also being made over here, and the video will be going on YouTube. So I want to just, this is a general term which people use for people having any kind of issues with their thinking or mental illness. So that's a good one. Yes, sir.
Unable to express negative thoughts.
Unable to
Express negative thoughts.
unable to express negative thoughts. Yes. Anything else? Any behavior thing you feel?
Behavior comes out of these thoughts.
Okay, that manifests into behavior also. Yes, sir.
Any type of madness.
Any kind of madness. Okay. Yeah.
Stressful moments and traumatic condition.
Traumatic condition and one more you said? Uske pehle?
Anxiety and
Right. Anxiety or traumatic condition, that can be mental illnesses.
Mental health is relating to your mind, your feelings, your attitude, your beliefs, your perceptions.
Right.
All that is part of mental health.
A sound mental health. Right. So then how do we derive at an understanding what is mental illness?
Mental illness is when your beliefs are not positive, they
Okay.
cause hurt to others, for example.
Okay.
Similarly with attitudes, if your attitude is not constructive,
Right.
always criticizing people.
Right.
Okay, so that is part of mental illness.
Okay.
Then your perceptions. For no logical reason you are assuming certain things about events and about people, which are not really based on sound reasoning. Again, that causes mental illness.
Okay. Wow, that's a very nice and a very clean understanding on mental illness. Thanks a lot. Can we give him a hand, please? Yes. Really nice. We have Mr. Partha Sarthi over here. He's a psychologist himself and is practicing in New Mumbai. I'm so obliged that he's come to attend my session over here. I feel very motivated. Please, sir, can you share your understanding of mental illnesses? It's going to be, try to make it easy language. Yeah.
What I call it, physically fit is called physically well, and mentally ill is called deficiency, because there is no dividing line between illness and wellness of mind. What we look for in a person, it depends upon our predisposed state of mind. He is ill, he is well.
Right.
And secondly, there is no concrete line. And moreover, illness is temporary. It doesn't remain permanently. It varies from loss of mood up to schizophrenia. Schizophrenia is a major part of mental ailment. That is supposed to be in human beings because of their electrochemical imbalance in the brain. So from this angle, I personally feel that whosoever is ill, temporarily is ill. But when we talk to them, sooner or later he becomes well. That is how I understand.
Lovely. Thanks a lot, sir. That is a very interesting sentence he said over here. I would like to clap for him. Thanks a lot. And whenever we talk to him, that's a very interesting aspect. The most imbibing myth about mental health is in our society is that in place of dealing with mental illnesses, we try to isolate people with mental illnesses. The most effective dilemma which is there in our society, that whenever we feel that somebody is affected by any kind of mental disorder, disparity, in place of giving that person any kind of attention or help, maybe we are not capable, we feel, or whatever other reasons, or we are not aware, we isolate that person, and that leads on further aggravating the problems in mental health. Like, I have all of you over here as people who have seen at least 30, 35, 40 years of life over here. Wouldn't you see a huge change in lifestyle in a Mumbai which was 40 years back and 40 years now? Do you see the shift from joint family setup to nuclear family setup? Do you see that?
Yeah.
Yeah, all of you agree with that? And earlier we used to have various people to share our heart out. If I have a heartbreaking relationship, or if my husband has not been good to me, if my children are not listening to me, I am going to talk it out with somebody in the family. But today, where is the family? Where is that family? It's shrunk, and even if it is there, uncle, auntie, or maybe there are people like neighbors whom we depend on. Maybe father, mother are staying in some other flat, and son and daughter-in-law is staying some other flat, another son and daughter-in-law is staying some other flat. When they have children, they are staying somewhere else. Like the whole 10-12 people family has got divided into two setups. Is it right, sir? So all of you would agree with that. I must be slightly younger to all of you over here, but this is what I have seen, the major shift wherein people do get isolated and they do not get people to share their feelings or their inane emotions. And talking, as Mr. Parthasarathy very clearly indicated, is a very major part of healing whenever a person is going through any kind of mental illnesses. Like if I put a normal person also in a very isolated environment, we wouldn't be surprised that in 3 or 4 months that person may start getting some mental illness or may become ill in some or the other way. Because we are born in society, and being part of a society is our most basic need. Talking, meeting, understanding, sharing, most basic needs. So when I look at the definition part, mental illnesses, with any kind of a condition which impairs you physically, in your thinking, that is in a cognitive manner, in any way in your emotions or your behavior with people, that is something which we call as a situation where you are suffering from some sort of mental illness, and therein you require help. Now if I ask you over here, what type of help would you suggest, as you are my esteemed audience over here?
Communication. Good communication.
One is good communication. Now communication coming from whom?
Society.
One is society, that we try to be responsible and still be communicative with them. But if I talk about qualified professionals, if I talk about people who are qualified in the field of mental health, what is the situation of awareness in that arena? We are starting from complete A. We talked about illness. Now we are talking about professionals who deal with this. There are various people who do counseling degrees. There are various people who do psychotherapeutical degrees, MSc, MPhil, various. There are MA in counseling, in clinical psychology. People who have done at least a 2-year of course, a master's course, are the people who are by mandate qualified to do any kind of counseling and helping people with therapies and assessments. They are the people. As per the Rehabilitation Council of India, which is a judgment body by Indian government, it is in Delhi, they have a proper certification for this. So whichever therapist you are going to or you are suggesting to somebody, please always try to check out whether that person is certified through degrees or through RCI. Very few people know about this. There are lots of counselors who are trying to help people, but then probably because of the lack of their proper degree or their proper certification, they are probably not completely versed to help. Maybe after 6-8 years, government is going to search out such people and ask them to get their certifications in place. Torture. I'm used to a mic which can go behind my kurti and this is not going. क्या हुआ? Should I continue? So when I talk about any kind of psychiatric disability, it is mental illness significantly interfering with the performance of any kind of major life activity, your day-to-day course, your work, your learning, you're dealing with people one-to-one, that is when we say that this person may be having some sort of mental illness or mental disorder, right? So even if someone has a habit of getting angry over small things, that also can be learned behavior, but that also can be a sign of excessive anxiety within that person, and that person needs some help, probably catharsis of some sort, or maybe change in his behavior, which we called as behavior modification techniques. So there can be various things which are probably a hindrance in a person's socialization concept, and that could also lead to understanding that this person needs any kind of mental health and is suffering from some sort of mental illness.
Society labeling bad labeling society.
I will always not say that the society labeling the bad person as bad is a sign, but yes, it is something to be kept in mind. Because for example, if I am checking out Mr. Partha Sarthi as a person, then I would also call his family to understand how is he as a father, how is he as a son, how is he as a husband, because these are the roles which get affected when I am talking to him as a person. And just to confirm and validate my data on him, I will always call somebody who can talk to me with proper evidence, examples. So it is a very, very scientific field. It has got nothing to do only with my notions or someone else's coming and complaining to me. There has to be, like for example, if in your arena there is a lady who is roaming without clothes. So you have never seen a lady roaming without clothes, and it's not acceptable in our society that a lady should be roaming nude, right? So that in itself is a notion that this lady has lost all kinds of thought, all kinds of logical comprehensions of living in a society, and she badly needs help. If you must have read some time back in the newspaper, there was a very, very famous model who was found in the streets of Mumbai eating food from the dustbin or something, and a very, very famous model. She was a cover of various magazines. I'm sure, I don't know, Bharat, do you remember the name or something? In Delhi or I think in Mumbai? She was from Delhi, but she was found in Mumbai.
Yeah.
She belonged to Delhi. She had become a huge cover girl for many years, and then she was found in Mumbai roaming on the streets. Then somebody from her, Powai somewhere she was found, and there people saw her on the road, and somebody recognized her, had an idea, took her, and now she is recuperating. That girl, that lady is recuperating from this mental illness, because of which she had left her house and flat and everything, and she was roaming on the roads. So that was our understanding of mental illness. Now there are certain bifurcations in mental illnesses. What type of diseases are there which should be taken care of